Hi, everyone, and welcome to today's educational video. My name is Sarah, and I am a certified exercise oncology educator and a care coach here at Jasper. I have been in the oncology space within healthcare for over 5 years, specializing in designing exercise programs for cancer patients throughout their cancer journey. I am delighted to be a part of the Jasper team as a care coach, helping members through all stages of their cancer experience. Our focus today is navigating relationships during cancer treatment. This will include how to navigate relationships within your family, your friends, your coworkers, and even the relationship that you have with your healthcare team. Before we get into the bulk of the presentation, I'll share the agenda for our discussion. I'll start with an overview of what Jasper offers, the partnerships that we have with other cancer organizations, and then we'll get into the focus of our video, navigating relationships during treatment. And at the end, I also have some resources to share with you as well. For those of you who are new to Jasper, we are a free digital oncology platform for cancer patients, as well as their caregivers and other loved ones. Jasper Health follows a whole person approach to meet each individual where they are on their journey. The Jasper app acts as a smart planner, a tracking tool, a resource hub all in one, and our Jasper Care Coaches, including myself, act as an extension of your traditional care. Our care coaches are available to make custom recommendations in the areas of nutrition, emotional and spiritual support, and financial toxicity and survivorship, to name just a few. Jasper members are able to track their moods and symptoms. They have access to educational articles based on their interest and any side effects that they have indicated, and they can receive help with appointments. All of our members experience one-on-one support and guidance based on their individual needs. Jasper's goal is to improve the lives of all people living with and affected by cancer by providing purposeful, individualized support. It is important for Jasper to have partnerships with other organizations who have this similar mission. That is why, to date, Jasper has over 60 cancer organization partners nationwide who have linked arms with to become successful in providing the most meaningful support for our members. To get into the bulk of our presentation, you may be concerned or already have experienced challenges within your established relationships. Undergoing cancer treatment can present many challenges that come up throughout treatment and beyond. So today we'll go into detail about the shift in role dynamics, communication, the emotional strain a diagnosis can cause, and also the impact on intimate relationships. When someone in the family unit gets diagnosed with cancer, it will likely influence the roles within your family and within your friend group. One of the first things to do is to simply acknowledge this fact that role in relationships will likely change during and throughout treatment. Acknowledging this is the first step in accepting the changes so you and your friends, your family can better adjust. It's completely normal to want to continue with your day-to-day responsibilities as usual, but it is important to be kind to yourself and have realistic expectations about what's feasible during this time. Physical challenges or changes, side effects, and the emotional toll of treatment are just a few reasons that your regular roles may feel overwhelming during treatment. While maintaining some sense of your typical routine and normalcy can be comforting, lean on your loved ones to delegate tasks where you can. Keep in mind here, many people want to help during this time, but they simply don't know how to be helpful. Taking small tasks off your plate is a perfect opportunity to allow them to help. And naturally, it's common for the caregiver to take on many of your responsibilities. If, for example, if you were the one to handle your family's finances, the grocery shopping, and providing transportation, now the caregiver turns into the accountant, the chauffeur, the assistant, helping to make the grocery list and cooking. It's up to you to decide with what you're comfortable continuing to do and keep an open line of communication to express what you would like to do and where you may need some help at times. If you have a teenager or a young adult children, it's important to consider the family dynamics that may shift in their regard too. And your children may take on much more responsibility than they have previously before the diagnosis. Make sure to check on them, how they're feeling, and that while they may take on the role of the caregiver, that their needs are being met too. It's up to you to be honest with others and with yourself to find what feels right for you. If cancer and the treatment leaves you feeling fatigued and unable to perform your normal responsibilities, someone in your family or close circle may pick up some of those duties. Maintaining an open line of communication with family and friends can be a big help here too. Talk openly about limitations and possible solutions that will help you and your family be much more comfortable during this time. Remember that you have every right to ask for help when you need it and try to allow yourself to accept help being offered from others. It's important to have open conversations with your friends as well. You may be that person in the friend group that everyone else goes to for help and advice, and really taking care of others could mean a lot to you. But be patient with how you are able to show up for others at this time. You may need to delegate to other friends at this time. There's nothing wrong with prioritizing yourself and your health while undergoing treatment. Remember that your values may shift during treatment, and prioritizing your health and spending time with your loved ones and your relationships may be a higher priority to you at this time, rather than working really hard to have a spotless clean house, for example. I would encourage you to figure out what feels best for you and manage your energy so that you have that energy to give for things that fill you up and that bring you joy. Another dynamic that may change is within the workplace. Some people like to keep work completely separate from their personal lives and choose not to share much information with their employer. Identify appropriate accommodations and actually find that coworkers to be an extension of their support system if you decide to share that with your employers and your coworkers. It's up to you to decide how you would like this to look. Having a conversation with your leadership team can help you decide what you would like to keep and what you would like to be adjusted. The bottom line is that you don't have to soldier on to prove that nothing has changed. Delegate tasks in your home or your work that are causing you frustration. Treatment may cause fatigue or impact physical function, so you should feel comfortable enough to ask for appropriate accommodations during treatment. Ask for help if you're finding it too exhausting to mow the lawn or go grocery shopping and then carry all of the groceries inside. If there are tasks at work that could be delegated to somebody else or that to give you time back to have during treatment, ask for that as well. Many jobs are able to be considered for remote work or have flexible hours during treatment. It's essential to have that balance between taking care of yourself, but also continuing to work or doing those home tasks that give you a sense of self and distraction. You'll have to figure out what works best for you and be open to many different solutions. As role dynamics shift in relationship, communication with your friends and your family, your coworkers, and even your healthcare team will become much more important. Talking about personal needs and feelings with honesty and openness can help lower stress for you and the people that you care about. Communication within your family or your close circle of friends is really important, even though it may be challenging at times to find the words to express the feelings that come up. You may have people in your life that want to help you, but they don't know what to do. Keeping an open line of communication sets the tone and gives them ways to help. This is the time where it's okay to be very honest and straightforward. If they want to help, tell them how, be direct about it. Setting clear communication boundaries may be something that you will need to think more about than you have previously. You will need to decide what you are comfortable with sharing about the diagnosis, when you would like to share this information, and how often. Sometimes when you share your diagnosis with friends or coworkers, or even acquaintances that you know passing by, they may feel entitled to share their own story or to give feedback about someone that they may have known to experience the similar diagnosis and give you advice based on that. While this is often well-intentioned, it can leave you feeling a little bit discouraged or even annoyed at times. It may be helpful to take some time to think about some possible scenarios, think about how you would manage that, and even become prepared with a standard response to say back in those situations. Think about what is something that you could say to redirect the conversation or make it clear that you're not looking for their advice. You could say something along the lines of, I appreciate your concern, but I am okay with my treatment plans and I trust my medical team. Remember that you are the expert on you. You know yourself, your body, your treatment plans the best. There's nothing wrong with being upfront and setting the tone for what you are comfortable with discussing. It can be common to struggle with balancing the desire to share with close friend, just to talk about it and get it off your chest, process through some feelings, and the fear of hearing unwarranted advice or feedback. You are allowed to tell them something along the lines of, I want to talk about this, but I really just need someone to listen right now. Having someone physically be there can be very comforting in and of itself, even if they don't say a word. Make the intention known for the conversation. I'm not looking for advice. I just want to vent about what's going on. Remember that you are your best advocate. The only way anyone can know how you are feeling is if you tell them. Take the lead in the conversation. Some friends or family members may avoid talking with you because they don't know what to say, or they may avoid it altogether because they don't want to upset you by bringing it up. If you feel like talking about it, then go ahead, bring it up. Let them know that it's okay to talk about this and that you do not expect any answers. You just want someone to listen. And on the other hand, it's okay to tell people that you do not want to talk about the diagnosis. You may prefer when you go out with your friends to laugh with them and focus on, their lives and what's going on. Focus on talking about the things that you enjoy. It's okay to set that tone and make it known what you would like during that time with them. Something else that could be helpful with communication surrounding the diagnosis and the updates is to designate a point of contact. This point of contact is someone that you trust, that you can relay information that you want to share with your larger group of friends and family. This can take some of the stress off of you in managing text messages, phone calls, people asking how you're doing, and for the health updates. You could have them even control a larger group message on your behalf. This can take some of the pressure off of you, the patient, and let your friends and family actually feel like they're providing you with some support. You can also invite your caregiver to access the Jasper app. This can help keep all of your information in one digital spot, and you can have a trusted companion access this to help you stay organized along this journey as well. Now, another area of communication that's essential to bring up is the conversations between you and your medical team. In the past, it really may not have been very necessary for you to have such a close relationship with your healthcare team, especially if you've never been diagnosed with a chronic health condition before. But during treatment, it's important to establish an open and honest relationship. Appointments can feel rushed at times, and you may feel emotionally distressed, making conversations even more difficult to navigate. During treatment, it's important to continue to advocate for yourself and get the clarification that you need. I would recommend to keep a journal and keep a running list of questions that you have come up throughout the week. Before your appointment, you can prioritize your questions from the most important to least important, since at times you may not have time to cover all of the questions in one sitting. You can try to address the most serious concerns first. And if you don't have time for all of the questions that you have come up, you can ask your medical team the best way for you to share that with them, maybe digitally or not, but just ask them what the best way to do this is. Another point within conversations with your healthcare team, and a helpful hint when using the Jasper app, is that you can track your side effects and your symptoms through the app, and it can be helpful in addressing those that come up, and that you can show your medical team trend lines and when those side effects were most severe, what times during the month or throughout your treatment. Bringing a friend or someone that you're really comfortable with, knowing all of your intimate health details, and ask them to take notes during that time so that you can really focus in on the conversation that you're having with your doctor. And you can take notes as well, and then ask your nurse or your doctor to review those notes afterwards to make sure that you hit all the main points that was spoken. You can also ask permission to even record this conversation. And another thing, if something is unclear during that conversation, ask them to repeat it. You have that right. Say, hey, I didn't quite get that, and ask for clarifying questions for that regarding that. It can be really effective in clarifying what was said when you repeat something back to your physician and say, hey, so I'm understanding it this way, or what I heard you say was blank. Your relationship with your healthcare team is the foundation of your whole cancer treatment plan. And it may take some time and energy to develop, but the more openness you bring, the better your experience will be. Along with communication challenges that come up in your diagnosis, we must also recognize the emotional strain that comes with a cancer diagnosis as well. We can acknowledge that this emotional strain not only impacts you, the patient, but your family, your friends, your close circle group. Your caregiver, oftentimes it's a spouse or a sibling, close friend, can feel this emotional strain the most. They are trying their best to take care of you, balancing the emotional stress with taking care of themselves as well. Caregivers can be anyone, and the risk of burnout is high. It's really common too that teenagers, on average, about 16 years old, will take on caregiving responsibilities when the parent is diagnosed. Young caregivers face a very unique situation. They may see an increase in household chores and caregiving responsibilities and a reduction in social time and extracurricular school activity. This can lead to having unmet needs relating to the uncertainty and dealing with emotional strain themselves about the parent's diagnosis. The stress of balancing these emotions can be overwhelming. That is why it's important to check in on the caregiver, especially when it is a child, and look for signs of burnout to avoid it. It's okay to not be okay. It's common to feel stuck with not wanting to make your loved one sad or to dampen the mood by talking about the diagnosis, but it's important to talk through how you're feeling in order to process those emotions. You may feel as though you are protecting your loved ones from sadness, but remember, it's perfectly okay and normal and for you to feel sad and uncertain about the diagnosis. It's normal to not want to share those feelings with your partner, your children, your siblings, or your close friends in order to protect how they're feeling. And yes, they may feel sad, but remember, they're going to feel happy, and so are you. A cancer diagnosis can be a roller coaster of emotions, and there will be good days and there may be bad days, but that's okay. If you are wanting to talk about the diagnosis, especially the more challenging days with your family and friends, but you're not sure how, I would recommend a couple of things. One, I would set aside a designated time to discuss your feelings. You could say, hey, I've had a pretty hard day. Let's have dinner together. And then we can talk alone for about 20 or 30 minutes about it. This way, it takes some pressure off of you and that person to understand what the agenda is. And after that conversation, it can be over. You don't have to talk about it again that day if you don't want to, but it gives you a chance to get it off your chest and focus on other things with them. I would also encourage you to write down what you're feeling. Write about what's going on to give yourself some clarity and to organize your thoughts a little bit before having the conversation. This helps you to process through some of the emotions that are there, but also gives you a chance to organize and think about some of the main points that you want to share. I would encourage you to check out your Cancer Center's Resource Center to look for support groups or to find one-on-one peer support. This could also help give you ideas on what to say to your friends and family from shared experiences with your peers. And you can really express yourself more authentically without protecting anyone's feelings, since they're not your close family, friends, or your main support. It gives you a chance to really speak what's on your mind and maybe a little less filtered to help process through. Another common part of emotional strain we don't want to miss is related to finances. Financial challenges can negatively impact emotions. The inability to work with the loss of income, the deductibles, and the copays adding up to increase your bills. Overall, the financial burden will play a large part in emotions as well. Your financial planning could be impacted along with your family's short and long-term budget. A diagnosis can oftentimes change plans for retirements and even traveling, which could cause feelings of sadness or anger. It can be helpful to reevaluate your priorities and work together with your family to establish new short-term goals, such as finishing cancer treatment. Priorities may shift, and it may be important to focus on yourself, your health, and spending time with your community and loved ones than before. Putting your financial goals on hold or on a delay rather than changing the plan completely may improve your outlook when it comes to your financial planning. Now, cancer treatments, chemotherapy, radiation, hormonal therapy, surgeries can lead to physical changes impacting your body image, along with changes in your sexual desire and function. During treatment, your body is going through pretty significant changes, and it's completely normal to feel upset or frustrated about this. Negative body image during cancer usually stems from a few different causes. There could be hair loss, weight changes, skin changes, surgical scars, or the loss of a limb can cause displeasure with the way that your body looks. Treatments can change physical function, which can also cause frustration. Along with these changes, the fear of rejection from your partner can cause psychological distress. It's really important here to be patient with yourself and with your partner. It may take a while to adjust to your new body, and as a patient, having lost the body you once knew and with it your sense of self can be very challenging. It's okay to grieve, to process, and to get to know your new body. Changing the conversation in your mind can be helpful in address these the way your body looks and how you perceive yourself. It's really common to be critical of yourself with a quickly changing body. Consider yourself asking, is this something that I would say to my best friend? If the answer is no, that you wouldn't, then don't say it to yourself. Express your feelings and be honest about your fears with your partner. If you can communicate your fears and your worries, you may actually grow closer to your partner. Remember that you, again, are the expert of your body. Discussing this with your partner is better than assuming. Don't assume that you know what your partner is thinking or feeling. They may not know what to do or say, so setting the tone and acknowledging the discomfort can improve your intimate relationships during treatment. There are multiple ways to continue intimacy throughout treatment, and it's important to find what works best for you and your relationship. As many as 84% of people with a cancer experience changes to their sexual relationship. It's important and not at all uncommon to bring this up with your medical team. Many of the changes caused by cancer treatment are temporary and usually improve after the treatment ends. As you recover, you may notice that your sexual activity go back to the way that it was. They're just temporary changes at times, and you can still be intimate without having to go through what it normally looks like. You may also experience permanent changes or longer adjustment periods. Be creative with your relationship and find ways to continue that connection. There are a few questions that I would recommend asking your healthcare team during treatment when addressing intimate relationships. Number one, is it safe to be intimate during my relationship? Two, will treatment affect my future fertility if this is important to you? What steps can I take before treatment begins? Three, are there any types of intimacy or positions I should specifically avoid? And four, are there any sexual side effects I may experience during and or after treatment? And if so, what can be done about them? Good communication between partners is essential. Being honest about these issues can help couples understand better what the patient is going through, as well as discussing ways to modify intimacy during this time. Every couple has different levels of comfort in talking about their sexual health and intimacy. If it's uncomfortable for you, or actually, even if it's not, consider getting help from a therapist or a counselor. There are the experts and can provide recommendations for managing the sexual side effects and suggest new ways to maintain intimacy. Although there may be a few obstacles to intimacy during treatment, maintaining an intimate relationship can be a really powerful tool for co-regulation. Nurturing connection between you and your partner, however it looks right now, can be a help to regulate your emotions and to manage stress. So now we'll get into some of the resources that we can offer as an additional help when you're navigating relationships during cancer. If you have young children, I highly recommend checking out the Bright Spot Network. This is an organization that provides cancer survivors that are parents of small children with resources for recovery, reconnection, and healing within the family. They also have a lot of great resources about how to talk about this with young children as well. Lots of children books too that can be really helpful in bringing up this conversation. Caring Bridge is a free online tool for sharing health updates. It provides a way to communicate with friends and family all in one digital place. And you can write out your health updates and invite people in who you would like to share those health updates with. It's kind of like that you're designating a point of contact to have everybody go in, and it's helpful to help you manage the text messages and the phone calls that can pile up when people care about you and want to know any health updates. Look Good, Feel Better offers in-person or virtual workshops to provide information on body image, skin and makeup techniques, and many more programs to help manage the appearance-related side effects of treatment. I would also, going back to the Jasper app and how to utilize it, one, I would invite someone to your care team on your Jasper account. This gives a chance to collaborate and help manage the cancer care process together more effectively. And two, in relating to the conversations with your healthcare team, to track your symptoms and your moods to address any most severe side effects and facilitate conversation with your medical team as well. For more conversation help, cancercare.org provides resources from professional oncology social workers for emotional and practical support with people for cancer, their caregivers, and their loved ones. They also have many resources to talk about loved ones in the family, children, teenagers, and even have good resources on the doctor and patient conversations. The Conversation Project is another great resource to help everyone talk about their wishes and share the way that they like their life to look. And they have some great conversation starters and guides that help prepare for conversations as well. And Five Wishes has some great resources for advanced care planning. Also, feel free to reach out to us on the Jasper app via the chat option, and we'd love to help provide you with any more information on these resources or connect you with any of those cancer organization partners. So this wraps up the educational video. I hope you all enjoyed today's this video and feel better equipped to manage relationships that have shifted during treatment. At Jasper, we understand that a diagnosis can feel uncertain and overwhelming at times. And remember, there will be challenges throughout your cancer journey, including navigating relationships, and that's completely normal. But with the proper tools, resources, and support, like what we've discussed today, you won't have to go through it alone. And as always, Jasper will be here to help. Please check out hellojasper.com website monthly for updates to our educational video series. Thank you all so much for listening and have a great day. Thank you.